Okay, no.
This is Emily. She's 19. She's a first year in USC, under a lot of stress. Her main complaints is a lot of neck stress, shoulder stress, low back stress, plus everything else going to be at USC is not easy. So what we're going to do is we're going to look at her just in, and we're going to notice, turn sideways to the camera, we're going to notice that she's carrying her head way too far forward. This could be all the studying, it could be wearing or carrying the backpack around school, or it could be looking at the iPhone. It's something. So really what we have to do is figure out how to get her to be there. That would be perfect, and most of her stress would probably go away in the back. But we're going to see whether we can find anything to begin with. So what we're going to do, we're going to do a few tests. Her legs are pretty even, so from a chiropractic standpoint, she's not showing too much discrepancy. Relax. So we're going to do some tests and see how weak or strong she is. Hold your leg here. Good. Relax. Hold your like there. Push to the side. Push to the side. No, to this side.
Oh.
Okay. Push to the other side. Very good. Hold this here. Hold it. Relax. Now, each one of these will tell me a neuromuscular circuitry of the body. She seems pretty good. Hold these arms up. Hold them up here. So, maybe it's just a postural problem. We're not finding anything so far. I'd like you to turn over on your back. Most doctors of any discipline would just go ahead and start doing some form of therapy on the low back, and we're trying to find the cause of this to make a permanent change. Hold the leg up, very strong, very strong. Bend the knee, hold this leg here, good, very good. Hold this here, very good, very strong. Let's have you hold the legs to the side, hold it, legs to the side, hold it. Hold this here, hold this here, hold this here. Lift the head up, hold it tight, turn. Basically, we can't really find any weaknesses so far. Hold this here. Let's see if she has this. Hold it here. Good. Hold this here. Good. We're going to see whether or not there's a lot of emotional stress involved. Hold this here. Hold this here. Okay, I'd like you to shrug your shoulders to your head. Hold this up. Good. Relax. Hold this up. Well, on a table, we can't really find anything. So tables aren't real life. So let's have her sit up. Swing around. Sit on this part. Raise your arms above your head. I'm going to push her. Good. Turn. Push her. Good. Turn. Push her. Good. Very strong in all of them. I want you to stand up. Face me. Hold your arms tight. Turn them here. Tight. Turn them here. Tight. That's pretty good. Hold it here. Do you wear orthotics at all?
I'm supposed to.
Did I make them in the
Yeah,
past?
yeah.
Okay.
Yeah,
So this is a problem coming from the feet up when she's standing. This is her difficulty. She can't do it at all. Now, if she wore her orthotics, which I think I made a couple of years ago for her, then her head would be carried back like that, and she would be in proper posture, and this burden wouldn't come. This is a 10-pound head about, and if you take any object, and I hold it here, I could probably hold it for several hours, but if I put this object, even though it weighs probably 5 ounces, in an hour that's going to weigh 10 pounds, 20 pounds, 30 pounds, and I won't be able to hold it up. The same happens with the head. her main problem is that she has a foot issue and she needs some training involved. She cannot hold her hand in this position. That's her only weakness. So what we want to do is we want to do an adjustment that will straighten this out, although it's temporary if she doesn't wear her orthotics. This is her main problem. So what I would like you to do is sit here. And I'm going to stretch her, put her in a position. She's going to lean back on my leg. She can put her hands behind her neck. And I'm just going to gently unfold her. Okay. And then I'm going to take a special instrument, chiropractic adjusting instrument, and I am going to reestablish the neural circuitry of posture. Again, it's going to be temporary. She's not doing anything to correct her posture. Stand up. Now stand. Just stand. Lift up. Right there. Just stay there. I'm doing the thoracolumbar juncture, which that point there helps with her posture. Just good. Hold it up. Hold it. So most of her problem is standing. She has to be treated in the standing position. So I'm treating her L5, her thoracolumbar juncture, and her cervical spine to try to correct how she stands. Hold this, hold this, hold this. There's a little jaw problem in here. Okay, just let your jaw go. Many TMJ specialists know that huge amounts of neck problems and back problems in this upper part come from the jaw. And that seems to be part of her problem. Lift your chest up. Put your head more this way. Hold this here. And it looks like she is a TMJ case. Stand straighter. Good. Open your mouth. Close your mouth. Open really wide. Close your mouth. Jaw to the right. Jaw to the right. Move your jaw to the right. Jaw, like this. Jaw to the left. Okay. Protrude it. Retract it. Okay, so every single time you breathe in, I want you to retract your jaw. Breathe in, retract, and relax. Again, pull it back far, and again, and again, and again. One more. Good. You okay?
Dizzy, yeah.
A little dizzy? Okay. So she's holding all of her stress of her life in her jaw. That's what's going on. Ready? Okay, so Emily, on that tiny adjustment, went into almost a collapse. Her blood pressure dropped. It was like an emotional release. It was a deep one. It took about 10 minutes to bring her out of it. And it all has to do with a family member who's been in the hospital for 6 weeks. And she's been worrying about this. And all that emotion came out. She's going to be really good in probably another half an hour. And who would know that all that was built into her body? So it wasn't structural, it was postural, and great stress that needed to be released.
Thank you.